Hi friends, welcome to Origyn Fertility and IVF. I am Dr. Rashmi Sharma. Today we will discuss ectopic pregnancy. But before that, if you wish to come to our center, you can see the number on the screen below. You can give a phone call and come to any of our centers. We have got 5 centers across Delhi. And if you wish to consult online, that link also you will get in the description box below, and you can consult us online as well. Now coming to the topic of the video today, which is ectopic pregnancy. So we will discuss what is ectopic pregnancy, how it happens, why it happens, how do you diagnose ectopic pregnancy, and let's say you have been diagnosed with ectopic pregnancy, how it is treated. And once you have had ectopic pregnancy, what are your chances of having conception, or how can you conceive next time if you have a history of ectopic pregnancy before. So coming to the first question, that what is ectopic pregnancy? Ectopic pregnancy means any pregnancy which is not there inside the uterus, but it is there outside the uterus, somewhere else in the body. Somewhere else in the body meaning sometimes the pregnancy may be in the tube, it may be in the cervix, that is the mouth of the uterus. Sometimes it may be just at the scar mark of the cesarean section, and sometimes it may be outside in the abdomen. Okay, so these are rare forms of ectopic pregnancy. The most common is tubal ectopic pregnancy, where the conception has happened but the baby has implanted inside the fallopian tube. It is not in the uterus. That is the most common type of tubal ectopic pregnancy. So we'll discuss about that. Okay, why it happens? For that you have to understand how a normal pregnancy happens. So we have earlier made a video on this, that how a pregnancy happens. You can see that video, but otherwise, in short, we all know that every lady forms one egg in a month, and that egg comes into the tube, and sperms traveling from the vagina through the cervix, through the uterus, the sperms, lots of sperms, millions of sperm, they reach in the tube. So egg and sperm, they meet in the tube. That means the fertilization happens inside the fallopian tube. Okay, and then tube gives nutrition to that early embryo, and that embryo develops for around 4 to 5 days inside the tube. Okay, so the early baby is developing in the tube, not in the uterus normally also. And when the baby is developing in the tube, it is also coming down towards uterus. While it is developing, it is also kind of rotating, and the tube keeps on moving with the help of cilia also, and with the help of movements also in the tube. The embryo kind of falls down in the uterus, and then it gets implanted into the uterus. So if because of whatever reason the tube function is not normal, meaning it has some adhesion somewhere, it is sticking somewhere, or its movements are not normal, then that baby which has conception has happened in the tube will not be able to come back into the uterus, and then it will get implanted in the tube itself, and that is what is ectopic pregnancy. But since the tube does not have so much of a space, the pregnancy cannot develop, cannot develop for more than 6 to 7 weeks of pregnancy, and then the tube bursts. And when the tube bursts, it leads to a lot of bleeding inside the abdomen. So that's how the patients usually present in an emergency, with torrential bleeding inside the abdomen. They've got almost 3-4 liters of blood in the abdomen. And it is a life-threatening condition. It is, it's an acute emergency. So it's really important to know about this condition, so that if you happen to have this, we can save your life. Okay. So what can lead to problems in the tube? So how common is ectopic pregnancy? I would say it is pretty common, like 1 to 2%. That means every 1 pregnancy out of 100 or 50 will be an ectopic pregnancy. Okay, so it's very common, very, very common. All right, but if somebody has had 1 pregnancy, ectopic pregnancy earlier, the chances of her having a second ectopic pregnancy is 50%. So once an ectopic, the chances of having a second ectopic is 50%. And why is that? Because tubes, they open very close in the uterus. So due to whatever reason, the one tube was damaged, that may be because of infections or because of whatever reason, the same problem is going to be there in the second tube also. So that's why once an ectopic, you are very high risk for second ectopic pregnancy. So that's why it is always said that if you have had an ectopic pregnancy earlier, whenever you become pregnant next time, we have to be having a very high index of suspicion for ectopic pregnancy, and we have to do testing fast so that we can avoid rupture of an ectopic pregnancy. So what are the symptoms that ectopic pregnancy can have? So sometimes the patients of ectopic pregnancy will present to us in an emergency. As I said, they don't know that it was an ectopic, it gets ruptured, they get a sharp acute pain in the abdomen, and they sometimes get a fainting attack also because they are losing so much of blood. It's an emergency, it is to be treated with an operation immediately. Okay, so that is when the ectopic is already ruptured. Otherwise, mostly it is diagnosed through ultrasound. You are getting an ultrasound done for an early pregnancy, and the ultrasound is not able to locate the gestational sac in the uterus. So immediately, we can see that, the pregnancy is there in the tube. So ultrasound is the mainstay of diagnosis. Sometimes when we are not able to locate the pregnancy anywhere through the ultrasound, we get blood test done with the name beta-HCG. So with the help of beta-HCG and ultrasound, we can try to locate the location of ectopic pregnancy. So let's say you have been diagnosed with ectopic pregnancy. How do you treat it? So if it is ruptured ectopic, as I said, it is an emergency, you have to get operated immediately. Sometimes the patient feels that she's not having any problem, but believe me, it is life-threatening. If the doctor is saying that you have to get it operated, please do it immediately. Okay, right? So this is when, if the ectopic is ruptured. If the ectopic is not ruptured, then sometimes it can be managed medically. There is an injection called injection methotrexate, which is an anti-cancer injection. 1 or 2 or 3 doses of methotrexate injection is given, and if what it does is it kind of desiccates the pregnancy there in the tube itself. And of course, you need a lot of follow-up. We need beta-HCG, serial beta-HCG follow-up, serial ultrasound follow-up, but many a times we are able to avoid a surgery. That is if the ectopic pregnancy has been diagnosed early. So once an ectopic has happened, right, now what are the chances for conception? So your chances of conception are a little less. Why? Because if an ectopic has happened, we know the tube is not good. That tube is not good for sure. And the second tube is also question mark, right? It may be blocked. It may be having same problem as the first tube. So the chances of having an ectopic pregnancy becomes high, and chances of having a spontaneous conception also becomes a little less. So in that case, once you have recovered from ectopic pregnancy, consult your fertility specialist. They will check your second tube. Then they will decide whether a normal try or an IUI cycle can be given to you. And whenever you become pregnant spontaneously or through IUI, early testing, early HCG test, early ultrasound to detect an ectopic if it happens again. And in many of the cases, these patients will need IVF because ectopic happens because of the tubal problem. So these patients so many times will need IVF. I hope this information will be useful to you. If you have some questions, you can type your questions in the comment section below. In our channel, we always have a live session on every Tuesday at around 12:15 p.m. So you can connect to us through that live session, and we try to take all those questions which are there in the comment section, and you can also have live question answer session during that time. So I hope this information will be useful to you. Thank you so much.